Prosthodontics residency is one of the many different specialties in dentistry. Stay tuned as we talk to a Pros resident in our new series called Four Quadrants of Questions. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about many different things. But this episode is about Four Quadrants of Questions. It's this video series where we highlight the different parts of dentistry, different specialties, and also different focal areas so that we gain insight as to what life is as a practicing dentist, as an oral health practitioner, but also as a resident in training as well. Today, we're going to be talking about prosthodontics. And our first guest is a recent grad, and he's going to tell you all about himself, but also we're going to ask him about 32 questions, right? 32 questions for this first episode of Four Quadrants of Dentistry. So let's get started talking about pros. So what's your name, sir? Who are we talking to today?
Afternoon or morning, everybody. My name is Dr. Webster Felix, and I'm a first year. Well, I just started my second year at USC Prosthodontics, and yeah, I'm still alive, so
That's
good.
Right. That's right. So let's get into these questions. These 32 questions here. So where are you from?
So I was born in Brooklyn. I was raised in Philly all my life, and so yeah, I hail from the East Coast, but I rep Philly.
Yeah. Okay. That's good. Now, you mentioned that you're a pros resident, prosthodontics residents, and what were you doing before Prostho? Like where did you go to undergrad school, and what was your major?
Okay, I went to Temple University undergrad. I was a biology major, so I got my BS in biology from Temple University. Graduated in 2011. So,
Gotcha.
Yeah.
And where'd you go to dental school?
I went to Columbia University College of Dental Medicine in New York. Graduated in 2015. So right out of undergrad, I went straight to dental school, and I joined the Navy. So I'm actually currently still active duty right now, on the active duty scholarship.
Gotcha.
At USC.
Gotcha. So with that means you didn't necessarily take a gap year between Temple and Columbia. You kind of transitioned right into dental school, right?
Yep, graduated May 2011. I had a little bit of a summer, and then dental school white coat ceremony was August 14th, 2011. Yeah.
Gotcha. So we're gonna stay on this quadrant of dental school. Why dentistry? Why'd you pick dentistry?
Well, it's funny enough. I think most dentists will have like an experience with an orthodontist. From what I've heard, I call it like the gateway drug to dentistry, because most young kids, like you're in the orthodontist office every 2-3 weeks. They're doing the tightening, they're doing this and that. And my orthodontist, I'll never forget, Dr. Anthony Farrow in Philadelphia. He was my ortho, and he taught me everything. Well, he showed me everything that he was doing. I just thought it was cool. And I would sit in a chair, and then I'd have like 6 chairs lined up next to me, and he's just bouncing from chair to chair. And he was just so cool. I thought he was so cool. And so that would spark my interest. And that was from 7th grade to 9th grade. I was with that orthodontist. And then when I saw what he was able to do with my smile, because I had some buck joints, like my teeth were like, hey.
Yeah, man. So, I know. I remember that. I remember that feeling. Me too. I had some spaces between my teeth.
Oh yeah.
All of that, man. All of that.
I was like, this is dope. And that gratification I got when I took the braces off in 9th grade, and I was just like, I like this. So that was definitely what sparked my interest.
Yeah. What did you like most about dental school?
I would say, honestly, the friends that I met. I think there's something to be said about going through an experience like that with like-minded individuals, people who are there for the same goal, people who care about teeth, which is very rare to find. Like in my class was like 82 or 83 or something like that students. So we were a very tight-knit group. And so I would say they are what helped me through dental school, definitely keeping my sanity. But to this day, some of my best friends are students I graduated with. So, I think the people that I've met and the connections that I've been able to make, both professionally and personally, I think that is, probably not the intention of dental school. I should probably say something like, a root canal or something like that, or something like that. But for me, it was the people.
The people. Well, let's flip it. What was your least favorite part about dental school?
I would probably say
I know there's
like the
probably a
mic.
long list, but
Yeah, there's a list. Like we got how much time we got. No, I would say like I don't know, like the microbiology, like that those classes because we at Columbia we parallel with the med students for the first year and a half or so, and in
right.
addition to that, we're still in pre-clinic and still like I think our Fridays were pre-clinic time for the first 2 years, and then Monday through Thursday we're in there with the med students, and then we were graded on an honors pass fail for most of our classes, but I think it was pretty rough. Definitely a lot of sleepless nights. So yeah, the exams I would say, but it's a necessary evil. So I guess I can't hate it too much. But
Yeah,
yeah, if
it's
I had to say one, then that would be it.
part of the process. Part of the process, right?
Yeah, yeah.
Yeah. What was the hardest part for you? Hardest part of dental school, and how did you overcome it during your time there?
Um, I would say maybe early on, like when we just started clinical, I felt like I was kind of being underutilized and in that like I was the self-proclaimed prophy king because every case that came in, it was a prophy. Like that was me that whole summer. And I'm like, 2 years I've been, working and preparing for this moment, and I'm sitting there just itching to actually do something. And so I think, you just got to know your limits and know the expectations of you, and not take it too hard that you're doing prophies or, you kind of getting acclimated with patient care. So, but that initially, I remember that was just a very frustrating time for me. But eventually things rolled around and I ended up with some pretty cool cases. So, just having patience and understanding, trusting the process, like it's going to be okay. But
Yeah,
yeah, that was for me the most frustrating early on.
yeah. And I know, while you're in school, there's a process of thinking about what you're going to do next, right? So, did you during your time, first, second, or even probably later than that, maybe your third year, but early on, did you have an idea as to what specialty or what focal area in dentistry that you wanted to, be a part of?
Early on, honestly, and I think Columbia is pretty heavy in pediatrics. And I think I do well with children. Like I have a niece and nephew at the time who were like, toddlers, and I just love the kids, Uncle Webby, love the kids. So I just thought pedo would be it. But then I started to do rotations, and after my first pedo rotation, I was like, nope, I ain't gonna be able to do this. I like kids, but I don't want someone else's kid screaming in my lap when I'm trying to do some dentistry. Dentistry is hard enough as it is, so I was like, nix that. And then I think rotations through all the different, that was one really cool experience about dental school was the rotations. I did a rotation at Woodhull Hospital, which actually was the hospital I was born at. And like it was oral surgery rotation, and I did so much surgery and so much, and it was just anything that I could dream of. Like they were guiding me and letting me just kind of just go for it. And I felt like that autonomy that I got on those rotations gave me a glimpse into what my future dental practice or dental life could be like. And funny enough, like I had a prosthodontist who was a mentor to me, who is a mentor, Dr. Magnani, and he actually interviewed me for dental school. And he was constantly pushing me throughout my 4 years of dental school. He's like, "Nah, you're gonna be a prosthodontist. Don't waste your talents like
He was
going down
recruiting.
this
He was
road." Yeah, he
recruiting
was like, he
already.
was like,
Right.
"You're gonna be a pro." So I didn't really like. I didn't believe him at first, and I love pros like fixed cases. Like I just enjoyed that kind of stuff. And yeah, he kept pushing me, and then funny enough, out of dental school, I actually applied for endo,
Mm.
which yeah, because I did a rotation or a global health externship in the DR, and I was doing a lot of root canals, and I consider it like a video game. So I was kind of like, oh, this is pretty cool. Like you just go down the file, take an X-ray, do the apex locator, get the beep beep beep. So I thought that was cool. But then with the Navy, they pushed me another route. So
Yeah.
long story short, I didn't really know what I wanted to do, but I guess pros was always in me from the jump. So
Yeah. Well, I mean, you mentioned three. You mentioned prosh, you mentioned pedo, and you mentioned endo. Which were
mhm.
there any specialties that you knew definitely that you did not want to do?
I mean, I was really open to most. I knew ortho for me. No offense to the orthodontists out there, and like I said, Dr. Farrow, my ortho, the first one to introduce me. No offense, but I thought ortho was boring, and so I personally didn't want to do ortho. But I appreciate ortho for bringing me to the dental world. But yeah, ortho was the only one I really kind of was like, it's not really my thing.
Yeah.
even oral surgery, like I don't mind bloody, gory kind of, but when it comes to like, Laforts and all that kind of like really oral max space, that wasn't really my lane either. I enjoyed taking out wisdom teeth, 1 in 16, and roll right out if you talk to it right. So, I enjoyed that. But
Yeah.
Yeah, it was really just ortho was kind of like I crossed that off. And then pedo
Yeah.
after that rotation.
Yeah. Yeah. So we know you're in pros residency, and you mentioned it as being one of the three that you were kind of exploring and had some experience or some exposure to. What about pros that made you kind of just fall in love with it and be the specialty for you?
Well, when like I said, when I was in the Navy, or I was in the Navy 2 weeks before I started dental school is when I swore in. So currently still active duty. Out of dental school, I did an AGD, and then I was solo dental doc for a 600 unit construction battalion out of Port Hueneme, California for 2 years. We deployed to Okinawa a couple of times, and as a solo doc on this unit, where there's some CBs who've been there for 5, 6 years on this operational unit, they literally are cycling in and out, doing missions, doing operations, and so none of them really have time for comprehensive dentistry, And so I found that while I was deployed and kind of stuck with a captive audience, I'm looking around and I'm seeing like a lot of just patchwork dentistry that was done. Granted, they got to get off and get on with the mission, but if I got these patients of mine here in my possession, in my purview for X amount of time, and I could do some full comprehensive dentistry, get them to see perio, get them to the different specialties, and kind of quarterback treatment plans. I found that was very gratifying for me. And to this day, like I'm still Facebook friends with some of my former patients, and they just like, they still hit me up, and it's just so cool to see that I was actually able to kind of at least, give them a little bit more than just like the, hey, amalgam and get on the ship, amalgam, get on the plane, get out of here, sort of thing. Which again, it's necessary because we're here to fulfill a mission in the Navy, but when I can, providing comprehensive care was something that I found very, very gratifying.
Yeah. So we're going to switch into the second quadrant here of questions related to pros. So how long is training for pros, including like any additional fellowships, internships? I know I had a couple classmates that did some fellowships like in implants. And at the time that was an emerging subspecialty or part of the specialty as well. So how long is your pros program? Any other thoughts for fellowships? Tell us a little about that as well.
Yeah. Sorry, 1 second. Sorry. Hold on, Arlo. I'm busy right now. Give me 1 second, okay? Yeah. So the pros residency is 3 years long. That program, I think most pros residencies are 3 years. And if you are interested in doing maxillofacial or some sort of implant fellowship, that's tacked on at the end. If like in this optional, for example, there's one third-year resident who's graduating right now from our program, and he's going straight into Harvard for maxillofacial. And so you can choose those things if it kind of sparks your interest. But here at USC, one thing I really like about USC is they're really trying to drive prosthodontists into the surgical aspect as well. So we have like an implant placement requirement. Like we're really learning a lot. Like there's a lot of implant knowledge that I thought I knew about implants, but already in this first year, like there's a lot more out there. So I think depending on the program you go to, each program has their different strengths. USC particularly is really strong with the literature and with treatment planning, and they're stepping into the surgical realm a little bit more, like I said. So they just expose you to just a wide range of pros, and you kind of just blaze your own path within that lane.
Yeah. What's the most unique part about pros? Like, what do you think is the most unique part about the specialty?
I would say the expansive nature of like the cases that you encounter. I think one cool thing that I've found is the larger cases that are kind of just showing up into our chairs, like for screenings. now after doing this for a couple months, because the first half of our first year we're kind of just in pre-clinic, just a calibration sort of thing, but then they unleashed us on patients back in October, and just in that time already I've just learned so much. And initially, if a case comes in my chair and every tooth is bombed out or every tooth is kind of worn down or teeth are missing here and there, and I feel like initially I would have gotten overwhelmed. But I think so far in my education, I've learned sort of a systematic way to approach each case. So like it's a system, like, and you just see it like, all right, what's the issues here? Like, what do we got? Like some vertical dimension collapse. All right, boom. How can we solve that? What's the issues? What are the ideological factors that are contributing to this case? And so you kind of work your way out. And then eventually the treatment plan, as you work through those different factors, treatment plan just falls into your lap. It's like, okay, boom, done.
Yep.
So easier said than done, of course, but it's just the system. As long as you kind of work that through, then you should be in good shape.
Yeah. What are some of the reasons why you think someone should consider becoming a prosthodontist? Like, what are some of the reasons why they should do it?
I'd say, like, if you're interested in really kind of providing comprehensive dentistry to, like, and working on comprehensive cases, large scale cases. I think in dental school, growing through dental school, like every time I saw a prosthodontist, I felt like they were just this ball of knowledge that I just could never have, because I feel like a prosthodontist is just like, they're just like here. And not to say that I don't think that that's still true, but it's just like, I just can see that the dedication to kind of learning the literature and understanding reasons behind why we do what we do. I think that is what's so valuable. And in our school here, I'm doing rotations with the pre-docs. Like, I do a CAD cam rotation every like Thursday afternoon or something like that. And some of the things that they just don't understand that I very clearly understand because I've kind of been through it. I think they just look up to us. And so it's like, they walk through the halls and they're kind of looking at our articulators. And like, there was the student who came up to me, he's like, wow, your articulator is so clean, so beautiful. I'm like, it's just simple stuff. Like, I can show you how to do that. And I think just like being a prosthodontist or being a prost resident, you're just going to be looked up to. So I don't know if that was the initial question, but that's kind of the path I took down.
That's spot on. But that's another side of it too, right? Let's flip it and rewind it. Why should someone not consider prost? Like, what are some reasons? What things about prost are unique to prost that if a person doesn't have these qualities or doesn't like to do X, Y, and Z, they should not consider prost?
If you don't like lab work, do not do prost.
Why is that? Tell everybody.
There is a lot of lab work. A lot.
I think a lot is a little word for how much.
Yeah, that lab is like, some days I can live in that lab. Like, it's a lot. First year we first started a wax up course. So I do a wax up course every Wednesday night from 7 p.m. to midnight with like one of the volunteer faculty that comes in. And basically we do full mouth wax ups on our own casts, just so that we can prepare when patients come in, that we can do a full diagnostic wax up ourselves. Eventually we can send those things to the lab, but we have to learn the techniques. We have to learn exactly how, like, the details, each tooth, dental morphology. There's a lot of lab work. There's a lot of, like, every patient you see, you take a diagnostic cast, you take a face bowl, and you mount the case. Like, you're in that lab, custom trays, it's all on you. So
yeah, I was gonna say, I mentioned my classmate that was prosthodontist, and that's the one thing he said, the lab work. And it's almost like you all as residents should get a CDT certificate, certified dental technician certificate for all the lab work, because you're doing all your cases too, right? For the most part.
Yeah, for the most part. When it comes down to the ceramic and zirconia frameworks and stuff like that, those things are going out. But even now, like, I think they're printing off like metal frameworks and CAD CAM, so they're starting to open those things up.
Digital dentistry.
And it's there. Yeah. But yeah, like, even like immediate dentures, I don't know, before I got to USC, I never seen a denture made like that. Like, I learned about it in dental school, and I've made dentures over the years. It just goes to the lab and it comes back. But no, like, I'm setting teeth, flasking, deflasking. I'm like, what is this? Yeah,
Keep in mind we mentioned digital dentistry. Guess what? they're printing dentures out now, 2 or 3 visits.
yeah,
That's it. So
yeah.
the technology and the workflow, especially that you are training in and being a part of and seeing what that system is like, digital dentistry is even enhancing that workflow, especially
Absolutely.
as a prosthodontist as well. Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters. We can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year. All right. But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com. newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. But you got to hurry up because residency application is right now. So shoot me an email right now. All right, let's get back to this episode. So,
Absolutely, yeah, it's a
so
cool time to be in.
So what's your typical day like as a resident, as a pros resident?
Well, it varies from semester to semester, but most days for me, I'm up like maybe 5 or 5:30.
Woo!
Yeah, it's early, especially because you heard my son, so he's out there hanging out, but like I got a 2-year-old here, so most days, I got to try to get up before the house is up just so I can get work done. Like right now, like I got treatment planning on my second screen here, and I just kind of crank it out before the house gets up. And then if I got class, most days class either starts at 8 or 7:30 on some days. So if it's on Zoom, I'll take it here or I'll go to the library at school. And then I've got patient care for half the morning. And now we just started like our summer semester. So it's strictly clinic time every afternoon. So clinic or lab time, so I just kind of schedule my patients accordingly. And then any lab work I need, I just kind of block that time out. And, literature reviews, I got papers to read, I got articles to summarize. And so, yeah. And then most days I try to get in bed by 9-ish. I try, but if I've got a deadline to meet, some days I have gone to sleep at, like this past week, I went to sleep at 1, and then I had to wake up at 5:30. And then I did that 3 days back to back. And so I burned out a little bit last week, but
it's a grind, man. It's like dental school on steroids.
On steroids, yep.
If there's ever any such thing. But yeah.
Yes.
How many patients do you see on a daily basis when you're in clinic?
So here, it's not really like, we're not very volume based, because our cases, like, even though a procedure in private practice, like, I don't know, data collection or maybe implant impression, stuff like that might take, an hour-long appointment. Most times the morning slot is for one appointment and the afternoon slot is for one appointment. So 2 patients really, unless we're just doing screenings, which Tuesday mornings for us is screening at the clinic. So I'll screen a patient Tuesday morning. And if I need lab work to do, I'll schedule that 1,300 for lab, or I'll schedule another patient in for that data collection. So then there's night clinic on Thursdays. So I think at max, the expectation is probably 3 patients, but with each patient comes just a whole slew of things that need to be done. So that's why I'm not like cranking out 10 patients in a day, because I just I wouldn't have the time, and the quality I think would start to diminish if I'm cranking out 10 full like rehab cases in a day, that kind of thing.
Yeah. What we're talking about cases, and you've had a chance even as a first year resident to do some cases, or at least inherit some cases, or continue some cases. What's been the most challenging procedure that you are actually working on, or actually have completed so far as a pros resident?
I would say so far, just starting our treatment planning. I didn't personally inherit any cases from the upperclassmen, aside from a few emergency cases here or there. But I've treatment planned 6 full mouth rehabilitations that I've just started treatment on. And so like the things I've done so far, just kind of like relining provisionals and, doing like immediate conformative provisionals for extractions that are being done. And so I think the most challenging thing so far is just understanding that workflow because, as a general dentist, I was practicing for 5 years in the Navy, as I said. And so I haven't done this level of comprehensive case, so to speak. Like I've done single units, I've done like multiple units, but I've never done 16 units at once. I've never had, 4 implants placed at the same time and trying to restore them while creating conformative provisionals. So I think just kind of organizing the workflow and, the expectations for each appointment, that's kind of been the most challenging just because I'm just used to being like here. So it's really just trying to expand my mind to understand like the bigger picture and why we're doing each appointment. So
yeah,
I
that
think,
makes sense.
that more so. Yeah.
What's the most common procedure that you've been doing that you
I'm seeing a lot of like not a lot of full arch cases, but definitely a lot of just like multiple implant like framework deliveries. I have seen a couple of full arch zirconia cases by some of the upperclassmen that they're delivering now because they're graduating going out the door. So I think that's been pretty cool to see. But those are pretty common. Just there's a lot of implant dentistry here. So
yeah,
restoring
yeah.
implants, that's like huge in process.
Yeah,
For sure.
and for many of those that may or may not know that are listening and watching, even in the U.S., there are certain segments of the country that typically have been a little bit more progressive in certain procedures, or even certain materials that are used. And usually, California over the last 50 years has always been one of those states or regions of the country where certain procedures, certain materials are kind of like used first before they kind of migrate over to other parts of the U.S. And so I'm not surprised to hear that, some of your most common procedures now that you're seeing are a lot of those full arch zirconia cases that are attached to implants, doing implant supported dentistry as part of those rehabs as well. So, so what is the most memorable case that you've worked on or procedure that has given you like the best feeling in the world?
Well, one of my first or probably my second or third rehab case, patient was severely perio involved. She had numbers, all of her maxillary molars were extracted and her mandibular incisors are gone. And I saw her for the initial appointment. I took the impressions, kind of did my workup. Treatment plan is for pretty much full arch maxilla, and then we're going to restore some of the edentulous spaces with this segmented splinted implants. And so for the last appointment last month, I fabricated a provisional from 6 to 11 from like I did a wax up on the impression that I took on the stone cast that I poured up. And so I had perio extract the incisors, and same day I had the teeth prepped. Same day I delivered that thing, and I was like, whew, it looked nice. Like it looked nice, and it was sturdy. And the patient looked at it, she was like, I love it. And it wasn't even my best work because I'm a first year. Like I'm just playing around in the lab, and I worked a long time on that thing.
Yeah,
I made 3 of them even just in case. The margins weren't right on the one that I loved, so I had to put that to the side, and I put the second one in, and then it sat perfectly, and she loved it. So I was like, yeah, it's just the first step, but that gave me the tinglies. I was like, yeah, this is it right here.
yeah,
Sure.
man, exactly. Yeah, when those transformations happen, it's
Something
special.
else.
It's special, right?
Oh
Got a
yeah.
little tingling feeling, and
Yeah.
patients get a little tingling. You might get a little tear
Right.
in the eye, and
Man.
it's just a good feeling.
Yeah, for sure.
But not all days are like that though. You have some tough spots. So what's the
Oh yeah.
toughest part about your training or your role as a future board certified prosthodontist? What's the most toughest part about your role so far?
I would say maybe a couple of things. So like in our first year, we also learned dental photography, which is huge.
Huge.
Documentation of
Yes.
your cases is major,
Yes.
not only for your portfolio, but also for medical legal purposes and for treatment planning for a patient to be able to kind of understand what your thought process is.
Yep.
So,
Absolutely.
And I really took to that. Like I love dental photography. Like I love it. Like just being able to I learned like all the, the ISO, the f-stops, all this and that, and just like the technical aspect of it and being able to diagnose what's wrong with this picture on the fly as I'm taking it in the mouth. That's been tough initially, and it's still some days like it kills my back physically because like you're hovering over a patient with a it's like a 6-pound camera and I got a ring flash and it's a lot. So it's physically taxing. It can be physically taxing on my body. At the end of the day, I try to do some yoga, like fix my posture, something like that. So I'd say the physical nature of what is required of you, like both in the clinic and in the lab, kind of hunched over a bench for multiple hours at a time.
Yep.
Some days I don't get lunch, on purpose because I just kind of get in the zone. I say that has probably been the most challenging, but that's dentistry in general too. Like no dentist is a stranger to the taxing nature on your body. But yeah, between that and just getting the picture just right, because some days the tongue ain't gonna listen.
Nah.
Some days like everything's fogging up and I'm just like sitting there sweating, holding a camera. I'm like, all right, that's it. We're gonna pick this up next week.
Yeah, well, hopefully there'll be some new inventions coming out where you have your camera in a certain position and there's a robot that just moves around.
Right.
And you're sitting back like this and you're just kind of like moving the robot like you're driving a car and takes a picture and boom, save your back, save your neck.
Let me work on that.
Work on that. Matter of fact,
don't even go tell nobody. Cut that part out.
Just put my name down as one of the co-authors and the co-inventors. We'll work it out.
No doubt.
Philly and Jersey represent. That's how we'll do it. That's how we'll do it. So we're going to move into the last quadrant here, the fourth quadrant here. And we'll talk a little bit about lifestyle, and then we're going to give you guys some bonus questions with regards to some tips. So hours per week. How many hours do you say you're doing as a pros resident? How many hours a week per week do you think you're related to?
Well, I'd say
pros
on average, maybe time I'm spending at school, like some days anywhere from 10 to 12 hours a day. I really shoot to not have to go in on the weekends. I've only done it maybe like 3 times since I started the program. And not to say that, some days you got to get something done. So I got to go in on a Saturday and, like my family's going to understand. But I really try to spend time with my family as much as possible, maximize that time. So the weekends I try to leave clear from going to school. But like I said, I was up at 5:30 this morning, so I guess you can count those hours too, because I'm still working on this presentation here. So
yeah, man.
Try to be present, like in and out. But let's see, 12 times 5 plus another maybe 20.
That's 80.
Yeah, that would be
80.
About 80. Yeah, we're probably looking at that per week.
Now, what about sleep? How many hours of sleep do you get a night?
Like me, I can't function if I'm like really sleep deprived. And like I've been listening to a lot of like I don't know if you're familiar with Sean Stevenson, like the Model Health Show. That's like a podcast that I've been listening to, and he wrote this book, Sleep Smarter, and basically like he just cites all these studies and stuff that I knew, but like if you're not sleeping, you literally can function as if you're like impaired, like by like almost similar to like alcohol impairment. Your productivity goes down, your ability to focus goes down, your ability to execute is just shot. So a lot of times, burning the candle on both ends for 6 months at a time, you're not doing yourself any favors. You're not doing yourself any favors. So I shoot for.
No, I say you shoot for. Go ahead.
Yeah, no, I really shoot to get at least like maybe 6 to 7 every night. That's my target. Like I've set reminders in my phone, like my sleep monitor, like the iPhone has that sleep. So
and the watches and stuff have stuff on them
it
as
tells
well.
you like time. Like some days I told you I have that wax up class on Wednesday night, so I be sitting in class and then my watch goes off like, oh, it's time to sleep. I'm like, we ain't doing that tonight. So some days I ignore it, but I really just try to set a goal for that. And then if I miss the goal, then I just I deal with it that way.
Are you a day or night person?
I used to be a night person, honestly. Before I had a kid, like I could do all nighters any day of the week, and I would have no problem. Right. But I don't know if it's because I'm just trying to kind of just get up before he's up and execute work at that time of day, or also being in the military, a lot of early mornings too.
Yeah.
So that probably has something to do with it as well. But I would say absolutely, like as soon as 10 o'clock rolls around, I am starting to feel the heat in the eyes. I'm like, all right, it's gonna be a rough one if I didn't have coffee in the afternoon. So
Yeah.
yeah, definitely,
Okay.
definitely AM, 100%.
Gotcha. Favorite color? What's your favorite color?
Gotta be that Columbia blue.
That Columbia blue. All right. What's your favorite food and drink?
mm, you know, uh, food is probably got to be oxtails. I love me some oxtail. Like,
Ah,
love me some
okay.
oxtail. Yeah, and my mom, we Haitian, so my mom, she makes this thing, or Haitians make this thing called legume. So rice, it goes with white rice. It's usually just like a bunch of vegetables and like they toss some meat in there, like a stew or a ragu sort of thing. But yeah, rice and legume and oxtails. Those are definitely my two.
All right.
And,
And drink? What's your
oh,
favorite drink? I saw you sipping on some coffee or
yeah,
something similar.
yeah, coffee. Coffee is what gets me through the day, and I've been drinking this. There's this mushroom coffee, so it's a lot of like cordyceps mushroom. It's like good
Yes,
for like getting the
yes.
brain cells
Yep,
going. So I've been doing
yep.
that. Four Sigmatic, not this the plug for Four Sigmatic, but Four Sigmatic has a great cordyceps mushroom coffee. Love it.
Gotcha. Favorite place to visit?
Ooh, favorite place to visit. Shoot, I would say home, like
Home.
wherever home is. Yeah,
That's
it's good
right.
to be home. Yeah, yeah. I'm actually heading to Philly, hopefully at the end of the summer. So haven't seen my parents in a minute, but yeah, not that you know, this is home too. So I can like just home in general, wherever home is. That's my favorite place.
Yeah,
Yeah,
yeah.
I'll call it that. Yeah.
Cool. So what's your favorite thing to do when you're not at school, kind of working on, as part of your responsibility and role as a pros resident? What's your favorite thing to do outside of school?
Like I just like chilling. Like I play basketball, lift weights. We got a little gym set up in the backyard here. Man, just chilling with the family is definitely my number one favorite thing to do. Because if I could just lay back and kick it and just kind of just have those moments that you ain't gonna get back. Like we're only getting older, so just gotta experience that time with the fam. And lately, I've
Yeah,
been kind of messing around with like you know stock market and cryptocurrencies and like kind of technical analysis. Like I find that stuff interesting. And I feel like if I wasn't doing dentistry, I'd probably doing something with like stock options or something like that. Like it's just I find that stuff cool, fascinating.
yeah, yeah. Gotcha. Gotcha. Hey, this is Dr. Darwin. Are you looking for some mentorship, some accountability, some help with getting all of this application and getting into dental school and getting into residency and then just your life as a new dentist? Look, I'm having monthly, twice a month, live coaching sessions and office hours so we can talk about all of that. I don't want you to struggle with the application process. I don't want you to struggle with getting ready for interviews. I don't want you to struggle about what list of schools and programs to apply to. We talk about all of that in our group, our monthly group called Dr. Darwin On Demand. Dr. Darwin On Demand. Check it out down below here. And then also, if you're interested and you want to get that help so you don't have to struggle anymore, so that you can get some mentorship, some accountability, and some help, hit this link right here. Hit that link right there so we can get you signed up and enrolled today. Today. Your future starts today. And I'm here to help you. This is Dr. Darwin. And join my members only community called Dr. Darwin On Demand. Look forward to seeing you soon, okay? Now back to this episode. Enjoy. What is one of the most common tips or oral health advice that you give to your patients?
I would say fluoride. Like fluoride is
Fluoride.
probably one of the best things we can do. Like my program director always says, there's nothing that we can do in dentistry that's going to make anybody's teeth any stronger except for fluoride, which is true because in order to modify a tooth to see the crown or repair like anything I do to the tooth, I'm not going to make it any better. So fluoride, let the patient do their part. Oral hygiene with fluoride and the literature that we're reading, like I think a lot of it, like you'll just see that the impact of oral health on the longevity of these restorations that we're doing. Like it's really that's one of the main factors. So yeah, fluoride, oral hygiene.
Yeah, especially with restorations that we know are not going to last a lifetime. It'll
Right.
last them some, some years.
Mm-hmm.
Probably longer than the car that the first car that they'll have, right? Or the tires on the car that they should have, because they're still going to bite and chew. But yeah, that I think the oral hygiene instructions and the importance of making sure that certain types of foods and drinks help to sustain those restorations and just sustain your overall oral health are important instructions to give to people. And people take it for granted, right? If it don't hurt, or they can't see it, or they can't feel it, they assume that it's okay.
It's all good.
Right, it's all good. So, so 2 last questions, and we'll wrap it up here. Tips, 3 tips for aspiring future board certified prosthodontic residents or board certified prosthodontist. What are some tips, knowing what you know now, what you've been exposed to as a first year going to your second year of residency? What are some tips of advice for those that are looking to potentially join you as a prost specialist?
I say, like, what do you mean, like as far as like application processes, or like just like in general to get to that point, like
just in general, right? Because
yeah,
I'm sure there's been different parts for you along your journey to where you are now, some of which many people still don't really understand how to make this something that they aspire to as well.
No doubt, no doubt. Yeah, I would say number one, definitely you want to stay current. I got my FAGD last summer, and so that continuing education, it's big. It's big. It's big not only in the application process, but also just in general. And not just staying current for the sake of staying current, but staying current because you're actually interested in what's happening in dentistry. I think as a prosthodontist or as a prosthodontic resident, it's just critical that you actually care about what the prognosis is for the stuff that you're planning to do for a patient, and why. I think knowing that why. So definitely number one is staying current. Two, just I don't know, in the Navy we have this term called embrace the suck. So it's not going to be easy, but you just got to embrace it and know that you are there for, like, you are working towards something. So just don't give up. If you don't get discouraged if you feel like you're just climbing up a hill that's impossible to reach. I'd say just if it hurts, then you're probably doing something right, because that means that the path less traveled is usually not the one that you or how does that saying go? The road less traveled. Just do it.
Yeah.
Just do it.
Just embrace it. Embrace the things that suck about your progression and the process of getting you to reach your goal, right?
Exactly.
Embrace the suck. Yeah. I like that.
Embrace the suck.
So people know. Yep.
Yeah, it's not going to be easy. And I guess lastly, we have a saying also in the Navy, semper gumby. So just always be flexible, because your path that you're going to take, it may not be exactly how you wrote it out, but I say just kind of remain flexible in what you were willing to learn from other people. Get a good mentor, and just kind of just keep your mind open, and just try not to hone in too hard on one specific detail or one specific route that you think that you absolutely need to take. Just kind of open up your mind a little bit and just expand your horizons. Get a good mentor.
Yeah, it's gotta stay fluid. Gotta be fluid. That's why water is 2/3 of the planet here.
Right. Be like water.
Be like water, and that means your body has to be like water, and your process in getting to your goals, you have to be fluid and be flexible. I like that. I like that. One last question deals with our profession in dentistry, and how we also are kind of somewhat part of medicine, at least most of the dentists we think we're part of medicine, but medicine doesn't think we're part of
Right.
of their ranks. But that's fine. But more so about dentistry. What's one thing if you could change about our profession, the dental profession, what would it be and why?
I think this probably goes, in the medical profession in general, but I think, I don't know, I find that a lot of people won't seek preventative dental care. They kind of just come to the dentist when something's broke. And I think it's just kind of important to understand that as providers, as a dental provider at least, I'm here to help you with the problems that have arisen, but I personally, like, it's not my problem, if that kind of makes sense. So like patients sometimes feel entitled to, like, hey, you owe me this, like you need to do this X, Y, and Z for me. Like I'm some sort of like, like bank teller, like, I provide you with a service and you're gonna, like, just that transactional relationship. I'm here to help with your problems, but I'm not responsible for what has happened here. So I think I find that patients tend to put a lot of onus on dentists in general to sort of be like magicians when preventative dentistry is the best dentistry. So I'd say just kind of that mindset shift.
Yeah, and I think that's a big issue that we have in the profession, primarily because there's less emphasis and there's less reimbursement and there's less gratification placed on the preventative side versus the reimbursement that goes to a root canal, a crown, or an implant. All of things that are procedures due to caries,
Right.
which is the number one chronic disease in children, but it's also the number one most preventable disease.
Easy.
So it goes back to prevention again, right? So until we get to that point where like it is in some of the medical models where you're able to really hone in on the prevention side of some things and actually have diagnostic codes that are associated with what is the root cause of this procedure that you are treatment planning, until we kind of make that paradigm shift into somewhat of the medical model, it's always going to be on the back end, which is, well, we'll fix the problem after the problem has already destroyed the tooth,
spiral, exactly,
and cause the tooth to have to be extracted.
Right. Well, let me get my magic wand and let me just fix it up real quick. And
Yeah.
It's almost... And another thing I'm seeing that I really don't like is, like, I'm seeing a lot of this dental tourism. And so, like, people trying to, going back to the financial aspect, people trying to save a buck, but they want, like, this certain level of dentistry. And then I'm seeing, like, for example, there's this Instagram page I saw. It's a clinic, I guess, in the DR or something like that. And when I tell you, I don't know what they're doing, but they look like they're just slapping chiclets on teeth, and it looks bad. Like, it looks bad. And so, like, and then the patients are coming back thinking, like, oh yeah, this is what dentistry is, and this is what dentistry should be. I'm going to tell you what I want, and then you're going to do it. And then I guess I think that this looks good, but, like, just going through that clinic's page, I won't name it, but I'm just looking at every case, and every case is a cookie cutter, and every case looks like I don't even want to know what kind of diagnostic workup they've done for those kind of things. So
yeah, and you bring up a great point, man. It deals with the whole notion of dental consumerism. Right, where dentistry is a commodity. There's a dentist in every quarter, so you can be able to get whatever you want. Somebody's going to do it, right? And exactly. that is an issue. That is a problem. But for many of us that know and have experience in helping people, we also know that the word "no" is a complete sentence, as in, no, Miss Jones, that's not what I recommend. But you're more than welcome to get a second opinion.
Yep.
And sometimes, we have to say no So eventually the patients can say yes, as in, yes, Dr. Webb, I want you to fix my mouth now, even though I've gone to X, Y, and Z, and you got to do it all over again. You know, patients don't understand that, and it's a lot of it's due to the fact that you know, dentistry is now at some level for some people considered to be a commodity, and you got you know, consumerism, and well, if you won't do it, Dr. Hayes will do it. But they don't know Dr. Hayes gonna say no too.
right.
But someone will say
Someone
yes.
will.
Someone won't say yes. So two great things about you know, things that we could change about our profession in dentistry, and this has been so helpful in learning a little bit more about you, but also about your training in Pros and what life is like as a Pros resident. So this has been very helpful, man. What's the best way for people to get in contact with you if they have some more questions or just want to reach out to you regarding Pros?
I'm on Instagram at DJ Webstar, 2 B's, 2 R's. You can also email me, webster.k.felix at Gmail. You know, if you have any questions at all, please feel free to just reach out. You know, I'm an open book. You know, most times I respond within a day or two if I'm not tied up. But you know, holla at me, reach out.
Sounds good, man. Well, I'm glad we reached out. Glad you helped out today in this episode of 4 Quadrants of Questions, 32 questions with a Pros resident. Hopefully, guys, this has been helpful. Check out these next set of videos as well. Hopefully, these will help you. And that's our time. Love, peace, and smiles. We'll see you on the next video. Thanks.